To other stories, and finding a working defibrillator, a tool that is used to shock patients back to life in Effia Nkwanta Regional Hospital in the Western region, is akin to the ninth wonder of the world. Now, the sole defibrillator in the hospital is currently faulty and was donated by foreign students. Health workers are distressed and are crying for a working defibrillator, insisting it is becoming difficult to save patients who are in cardiac arrest. Jojo Kobina has more in today's episode of Sick Hospitals.
A defibrillator is a life-saving equipment. When the heart is not beating normally, the defibrillator is used to deliver controlled electric shock to the heart. This shock can help restore the heart's normal rhythm in cases of sudden cardiac arrest. In countries like South Korea and the UK, defibrillators can be found in public places like pubs, markets, and crowded places. What about Ghana? The Ghana Harmonized Health Facility Assessment Report 2023 says only 5% of hospitals in Ghana have the required basic equipment in consulting rooms. We make our way to Ghana's oil city, Takoradi. The Effia Nkwanta Regional Hospital receives referrals from across the region. It is fair to say that it serves over 3 million population. Apart from cardiopulmonary resuscitation, CPR, which involves chest compressions and rescue breaths, can the hospital save your life if you go into cardiac arrest?
I would say that we're doing the best that we can under the circumstances. At the A&E, where you are most likely to be taken to, we have just one defibrillator. But for a unit of that size, we should have more. So in your case, if you are the only one who needs the machine at that point in time, yes, we will be able to do it for you. But if there are many patients who need the same service, then it becomes a challenge.
Dr. Joseph Kojo-Tambil, the medical superintendent of the hospital, is passionate. He wants his medical staff to get the best equipment to serve patients. But he also wears another hat to manage the information he gives the media and also assure residents of the Western region and beyond that they can rely on his facility. With some hesitation, he admits that even the only available defibrillator has challenges and calls for resourcing of the hospital.
And the defibrillator doesn't work properly, like it function
with
well.
A few challenges, but with batteries and all that. But when called upon, it would function. But like I said, we need more of those machines rather than just one.
So we went to the Accident Emergency Center to find out how the facility handles cases of cardiac arrest.
We have one automated external defibrillator. It's faulty because the battery is irreplaceable. So the battery went down and we can't replace it. So now it's malfunctioning. So when we have, if our patient suddenly arrests, it's difficult for us to determine the rhythm so that we can apply the shock. We are not able to do that. This is a life-saving machine. You can have cardiac arrest at any point in time. When we are intervening, it's a must that we have an automated external defibrillator.
The only defibrillator, which is now faulty, was even donated by foreign students who saw the need for the equipment in the emergency room. To make you understand the issue better, Regina Kweku, the unit head of the Accident and Emergency Center, shares a recent story.
We had this patient that was brought in with electrical shock. With that one, because of the external electrical current, it sends the rhythm to a different rhythm. So if we had this, we could have reversed, we could have shocked the patient to set the rhythm to the normal. But because we didn't have, we continued with our CPR, and when we were all exhausted, we had to call it.
For those who do not understand what the term "call it," it simply means they had pronounced the patient dead. How often do they call it?
So it does happen very often. Very often.
The search for a defibrillator at the Effia Nkwanta took me to the intensive care unit. Here, they provide critical care to patients. The unit also needs a defibrillator. Is there one here? Mavis Mills is a supervisor at the ICU.
We need, for now, we don't even have a defibrillator here. They brought one, but they said there was a problem with their battery. So they sent it, and for now we don't have a defibrillator.
You are anywhere in the Western region, and when something happens to you, like an accident, or you have a heart attack, or some other condition, you are most likely to be brought to Effia Nkwanta. And if we are not in the best situation to be able to help you, the consequences can be dire. So we want to appeal to all of them to look at this place. Let's collaborate and see where they can put their money in to improve on the quality of services for Effia Nkwanta. And if they do so, it is for the entire citizenry of the Western region and even beyond.
Clearly, the Effia Nkwanta Regional Hospital needs healing. George Kopna, Joy News.
Well, let's have a chat on this. And joining us via Zoom is Kwame Sapansiedu, pharmacist and research fellow at CDD Ghana. Grateful for joining us. How did we get here as a nation?
I'd say good evening, and good evening to your listeners. We got here because we haven't, from a policy and political standpoint, invested in health infrastructure. And that's how we got here.
It's sad. But if that's how we got here, how do we change the narrative?
Well, it's about being intentional and purposeful and deciding that we value the lives of our citizens and people shouldn't die like chickens, where CPR cannot revive you. And even without health professionals knowing that you've actually passed, they call it. It's about being intentional. And I don't think our politicians are intentional enough. They don't procure healthcare in our jurisdiction. And therefore, sometimes think that as a result, they can get away with the rest of us.
Okay.
Procuring healthcare at this level. And that's the fundamental truth.
So it means that's where the answer lies, that our politicians should change the way they view healthcare. I'm grateful to you for joining us here, Doc.